Hello, fellow investigators, and welcome back. Today, we're stepping right into the clinic, but for our purposes, let's just call it what it is, a crime scene. Our mission, should we choose to accept it, is to solve one of the most common and honestly one of the most confounding cases in all of neurology, the mystery of the weakened limb. So, the case begins with a statement that sounds almost simple. A patient comes in and says, "Doctor, I feel weak." But you and I know as seasoned detectives that the simplest facts often hide the most complex truths. This single complaint, that's our first clue. It's the thread we've got to pull to unravel the entire story. So grab your magnifying glass, get that thinking cap on, because the game is afoot. You are the consulting detective on this case, and we are absolutely going to crack it together. Ready? Let's do this. All right, first principle of any investigation. You have to observe everything. Before we jump to any wild conclusions, we have to carefully survey the scene. And what that really means is taking a meticulous history and truly understanding what the patient is telling us. First things first, we've got to identify the real culprit here. Are we dealing with true weakness, what we neurologists call paresis, a real, measurable loss of power, or is it an imposter? You know, patients might say weak when what they really mean is they're tired or that it hurts to move. Our first job is to nail this down, because a true loss of motor power, well, that points us down a very specific investigative path. Now it's time for the initial interrogation. We need to ask the right questions. Where is the weakness? Is it hemiparesis, affecting one whole side of the body? Or is it paraparesis, just in the legs? Next, the timing. When did it start? Was it a sudden event, like a thunderclap out of nowhere? Or was it a slow, insidious creep over weeks or months? And this is crucial. Are there any accomplices? Any other clues hanging around, like sensory changes, vision problems, or trouble with speech? The answers to these questions start to draw the map of the crime for us. Okay, so we've got the initial testimony recorded. Now it's time to search for some hard physical evidence. We're moving from the history to the physical exam. This is where the silent signs are going to tell us the real story. This is how we localize the lesion. You know, to really get weakness, you've got to understand the chain of command. Think of it like this. In order to move, it starts at headquarters, right? That's the motor cortex up in the brain. That order then travels down this massive communication line, the corticospinal tract, to the local precincts in the spinal cord. And from there, the lower motor neurons, our officers on the beat, carry that final command out to the muscles. A disruption anywhere in this chain means weakness. Our job is to find exactly where that breakdown happened. And that brings us to our most valuable tool. Seriously, this right here is your detective's cheat sheet. The evidence we find is going to point to one of two main suspects: an upper motor neuron, or UMN, problem. That's a problem at headquarters or in the main communication line. Or a lower motor neuron, LMN, problem, which is an issue with the officers out on the street. So look closely at these clues: tone, reflexes, fasciculations, atrophy. Each one tells a completely different story. Let's start with those telltale reflexes. With an upper motor neuron lesion, those inhibitory signals from the brain are basically cut off. So the local reflexes, they're left totally unsupervised and they just go wild. That's what gives you hyperreflexia. But with a lower motor neuron lesion, it's like the telegraph wire from the spinal cord to the muscle has been snipped. The signal just never arrives. The result? Hyporeflexia, or maybe no reflex at all. It's an elementary distinction, my dear Watson, but it has profound implications. And the clue in the muscle tone is just as revealing. With a UMN lesion, you feel spasticity, that sort of velocity-dependent resistance, almost like you're trying to open a rusty hinge. But with an LMN lesion, that muscle has totally lost its connection to the nervous system. It's flaccid, limp, like a rag doll. So think about it, just by checking reflexes and tone, you've already narrowed your search area in a huge way. So, we've surveyed the scene, we've gathered our physical evidence. Now it's time to put all the pieces together, follow the logic, and create a list of our prime suspects. This, my friends, is the art of the differential diagnosis. And this is our path forward. This algorithm isn't just some boring flowchart. It's our investigative roadmap. It makes sure we don't miss a single step. By systematically following this map, we can take our whole collection of clues and deduce the precise location of the lesion. It's brilliant. We can break this whole complex map down into 3 pretty simple steps. Step 1, what's the distribution? Let's say we find hemiparesis. Okay. Step 2, we hunt for our key clues. Are there UMN signs like hyperreflexia? If the answer is yes, the map immediately points us down a central path. So, step 3, we follow that path. UMN signs and a hemiparetic pattern points us squarely toward a lesion in the brain or the spinal cord. See? We went from a really vague complaint to a specific location in just 3 logical steps. We have our location. We have our prime suspect. Now it's time for the final phase of the investigation. We need incontrovertible proof. It's time to call in the specialists. This is where we bring out our advanced forensic tools. If our investigation is pointing to the brain or spinal cord, we get an MRI to get a direct look at the scene of the crime. If the clues point more toward the peripheral nerves or the muscles, we deploy nerve conduction studies and EMG. This is literally like interrogating the nerves and muscles themselves, listening to their electrical signals to see exactly where that communication is breaking down. These tests confirm our deductions and they close the case. And just like that, the case of the weakened limb is solved. not by some single brilliant flash of insight, but by methodical observation, careful evidence gathering, and pure logical deduction. The great detective was right. The world is full of obvious things that are just waiting to be observed. And with this framework, you now have the tools to observe, to deduce, and to bring clarity where there was once only mystery. You can see it.